this is a case where a lady presented with the syncope, and cardiac involvement in the form of third degree AV block. So this is a very good question. Now, so this is a lady who has a 2 episodes of unexplained syncope in the past months. 3 years ago, he has a self-limiting erythema nodosum and bilateral ankle arthritis which resolved without treatment. This is a very important point. Now, when we have done the examination, we have seen that the pulse is 58 regular, blood pressure is 110/70, no murmur, no sign of the heart failure. Now, if we see the cardiac specific investigation, the ECG has shown intermittent complete heart block, which is occasional, which is the cause of syncope in this lady. So we have a young lady with syncope and occasional AV block, and also ventricular ectopics. Echocardiogram is normal. Now we have done the cardiac MRI, which is gadolinium enhanced, and what we have seen patchy mid myocardial and subepicardial late gadolinium enhancement, which is a characteristic thing that we see in cases of the sarcodosis. So this is a case of cardiac sarcodosis. The diagnosis has been made, and in the lab we have seen that ACE levels are elevated. What are ACE inhibitor? Angiotensin converting enzyme levels are elevated, which we know are elevated in cases of the cardiac sarcodosis. Now, what will you do in this case? Before going to the treatment, first see this. What will be the next step? So now the same lady has been gone for 18 FDG, 18 fluorodeoxyglucose. Now see, these are two kinds of the cardiac tissue. The first is the inflamed cardiac tissue. This is an inflamed cardiac tissue. When it is inflamed, the uptake of the 18 FDG will be more. That means it is active cardiac sarcoidosis, and so it is an active cardiac sarcoidosis. So what fun we'll have in knowing this? Now, this is very responsive to the steroid, so such patient always receive steroid. On the other hand, if it is non-active cardiac tissue, that means there is low FDG uptake in the cardiac tissue, so they does not respond to the steroid, so steroid is not given. So 18 FDG in these patients is done not for the diagnosis purpose, it is done to know whether the case is active, because if it is active we will give the patient steroid, and if it is not active then will not use steroid. Now please remember one very important thing, that is permanent pacemaker is for bradycardia, and the cause of death in sarcoidosis is not bradycardia, it is ventricular fibrillation. So that is why permanent pacemaker has no role. But if the patient comes to you, what you will do? You will do the temporary pacemaking. So temporary pacemaking, because the patient is having third degree AV block. So temporary pacemaking, you will stabilize the patient.